Eastern equine encephalitis is an extremely rare but serious and often fatal infection that causes inflammation of the brain. The spread of the EEE virus to mammals, including human and horses, occurs through the bite of a certain infected mosquito species that feeds on both birds and mammals. Symptoms of Eastern equine encephalitis in a horse include fever, a sleepy appearance, some muscle twitches of the head, neck, shoulder, and flank, and a weak, staggering gait. Affected horses are soon down, unable to stand. There is no effective treatment. The fatality rate is 90% or higher. A horse that survives may have permanent brain damage. Horses contract West Nile virus when a mosquito has previously fed on an infected bird and then bites the horse. The virus affects the central nervous system. Symptoms mimic encephalitis and include any of the following: loss of appetite, depression, aimless wandering, walking in circles, weakness or paralysis of the hind legs, and inability to swallow. There is no specific treatment for West Nile virus, however, supportive veterinarian care is recommended. Although death can occur, the majority of horses infected with West Nile virus recover.
Lyme's disease is a bacterial disease spread by ticks. It can affect not just horses, but also commonly human and dogs. It is most common in the northeastern, mid-Atlantic, and north-central states. Ticks can pick up this bacteria as larvae or nymphs by feeding on the blood of infected mice and then transmitting it to their next host. Spring and fall are prime time for infections. Generally, a tick must feed for at least 24 hours before transmitting its infection to the new host. Common symptoms include stiffness in large working joints, lameness, generalized tenderness or sensitivity of the horse, low energy levels, low-grade fever, joint swelling, sore back, and behavioral changes such as unwillingness to work, depression, or irritable attitude. If you think your horse has Lyme's disease, you can conduct blood tests, however they do not always yield a clear answer. Lyme disease is treated with antibiotics such as tetracycline and doxycycline. There is no vaccine against Lyme disease, so the best prevention method is to check your horse regularly for ticks and stay out of the tall grass and bushy areas.
Equine anaplasmosis is a tick-borne disease caused by Anaplasma phagocytophila. This is a bacterium that lives within blood cells and is carried by deer ticks, the same ticks that carry Lyme disease. The disease is not contagious from one horse to another, but multiple horses on a property may be infected, depending on the local tick population. Horses most commonly get sick with anaplasmosis in the fall to late winter. They commonly show signs of fever, loss of appetite, reluctance to move, leg swelling, jaundice, and lethargy. Occasionally, horses may show neurologic signs or have trouble rising. This bacteria invades some white blood cells, leading to the destruction of red blood cells, white blood cells, and platelets. Blood work show low platelets, which are important for clotting the blood and anemia. The most definitive way to diagnose the disease is to look at the blood cells under a microscope to look for the presence of a bacteria inside the neutrophils. The treatment for anaplasmosis is the administration of tetracycline, usually oxytetracycline, minocycline, or doxycycline. Some horses with mild disease may recover without treatment. Most horses recover fully, although some may relapse in 3 to 4 weeks. Fatality from the disease is rare. There is currently no vaccine available, so prevention is limited to tick control. Equine infectious anemia, or EIA, is an infectious disease of horses and other equidae. It is caused by an RNA virus classified in the lentivirus genus, family Retroviridae. The most important mode of transmission of EIA is by the transfer of virus-infected blood by blood-feeding insects such as the horsefly, deerfly, and less commonly the stable fly. It can also be transmitted through the use of blood-contaminated syringes, needles, surgical equipment, or by transfusion of infected blood or blood products. Equine infectious anemia is a virus that causes the destruction of the horse's red blood cells, causing anemia, weakness, and death. EIA is a reportable disease in the U.S., which means that if it is diagnosed in a horse in this country, the veterinarian is required to notify the USDA. There is no cure for equine infectious anemia. Horses are required to be tested for this disease for entry into horse shows and for other transport across state lines. This is a simple routine blood test called a Coggins test. EIA can present itself in an acute form or chronic form. The acute form is usually fatal. If the horse survives, it will become a chronic carrier of the disease. Once infected, the virus remains in the horse's body for the rest of its life. Common symptoms include anemia, lethargy, weight loss, fever, enlarged spleen, swollen belly and legs, depression, decreased athletic performance, or death. To diagnose EIA, your veterinarian will usually conduct a Coggins test on the suspected animal, which is a laboratory-run blood test to diagnose EIA in horses. If the horse in the U.S. is diagnosed with EIA, there are 3 options mandated by the USDA. Since it is a reportable disease and there is no cure, the first and most common option is euthanasia. Secondly, the infected horse can be donated to a research facility. Thirdly, the owners can construct a completely enclosed barn covered in wire mesh, and the horse is forbidden with any contact of other horses. Due to the cost and limitations of the third option and the limited number of labs that will accept EIA-positive horses, most cases result in euthanasia.